The issue that has arisen with meloxicam in cats, I think, is probably because meloxicam is an approved product for cats, and because of that we've seen a lot of use of meloxicam. And I'm going to remind veterinarians it's not until a drug is in widespread use that more subtle adversities that don't show up during the approval process emerge. And so during the approval process, if we study 6 to 12 cats, we're lucky, but during the post-market period we'll see thousands of cats on these drugs, and so and the same is true for dogs. So these more subtle adversities do emerge. If you go to the FDA Center for Veterinary Medicine's adverse event reporting site and you look at meloxicam and renal disease, you will actually find that it's not just meloxicam. And in fact, I don't think the issue is meloxicam in cats as much as it is nonsteroidals in cats. I think feline kidneys are different than canine kidneys, and for that reason I think that the renal adversities emerge first in cats compared to gastrointestinal adversities in dogs. And in fact, if you look at that website, nephrotoxicities or renal adversities are pretty common in dogs receiving nonsteroidals as well. So to answer your question, do I think meloxicam can be used long-term safely? I think under some circumstances it probably can. There's some data to support using it at a much lower dose, and we're talking 0.1 to 0.15 milligram total dose in cats, or 0.03 mg per kg, once a day to once every other day may be a reasonable way to use the drug. There's a couple of caveats. Because the FDA has sent out, and Boehringer Ingelheim has sent out a warning letter, I think that this needs to be a decision that's made in concert with the veterinarian in the context of his client-patient relationship, maybe even informed consent sign. And I think also renal function needs to be monitored in these patients, and certainly the older they are, the longer they've been on the drug, using other nephroactive drugs, cardiovascular diseases, patients with high creatinines that are normal but still nonetheless in the high range. I think renal function should be followed in those patients, and maybe even paying attention to specific gravity and maybe protein in the urine as potential early indicators of issues. So if the veterinarian and the client are willing to do that kind of monitoring, I think a nonsteroidal might be used long term. And since meloxicam is the one that's been approved for use and for which we have some evidence of safety, that would be my choice. I think we're going to have problems with the other nonsteroidals in cats just as much. And then the other thing that you can do to decrease the need for a nonsteroidal, or certainly the dose, is to use these alternative analgesics that have maybe some long-term benefits, such as gabapentin, and there may be others as well. Amantadine is another one that emerges in the literature as combination therapy for controlling pain in cats.